morning, good afternoon, good evening, guys. This depends on where you're watching from. My name is Zippy the nurse on YouTube, but as you all know, my name is Zipporah Nishohi. I normally bring for you interesting videos, and today here we've been joined by amazing, beautiful nurses all the way from 254, that is Kenya. How about you?
Zuri.
So today I want them to introduce to you guys. To my right side is beautiful Faith, and this is Esther, and I would want them to introduce themselves to the camera and audience. So hi, you Faith?
Very well, thank you. Yes, so my full name is Faith Malavu.
Yes.
I'm a nurse professional, and that is what I do for a living.
Wow.
Yes.
Okay. So can you tell us slightly, before we go to Esther,
Yes.
for how long have you been a nurse?
Oh my goodness, now I don't remember how many years. I finished training in 1991.
Wow.
So I've been in practice all that time.
Let me not say
Yes.
where I was by then.
Yes. I'm sure you are not even born.
I was, but
Probably.
yeah, let's leave it for the audience not to know that.
Yes. So I've been practicing since then to date.
Wow, that's
Yes.
interesting. What about you, Esther? Tell us your name and let the viewers know who you are.
Hi everyone, my name is Esther Gashoya. I am a nurse for the last 23 years, and I've been under the mentorship of Faith Malavu. And yes, we are making a difference in the nursing profession in Kenya.
Wow, that's interesting. And today I'm under the mentorship, as you can see. As you can see on their tops, there is something that they've written here, Aeners. So what is this Aeners, Esther?
Oh, Aeners is a company by nurses for nurses.
Wow.
So our main objective when we started, Aeners came from Ava Medicare, and Ava Medicare is the first company we formed that did home care services. And Aeners came when we needed to start training, and we wanted also to do mentorship for the young nurses who we work with, and there are actually very many in this country. And most of them finish nursing schools, go to work, there's no mentorship. So we came in to step in to do mentorship for young nurses. And from there, we came up with a training. However, we are only training the healthcare assistants. For nurses is mentorship and preceptorship.
Wow, that's interesting. So this question goes to you, Faith.
Yes.
So does it mean that Aeners is a business, Aeners is a hospital, or like the way Esther has explained, it's a mentorship sort of a thing? So to me, I'm taking it like it's a business. So why are you nurses not in the bedside, but you're kind of in the entrepreneurship? Because so many people out there want to go abroad and do businesses and do nursing, especially for us nurses, because we believe that in Kenya there is no good money for nurses. But you're here, you're doing so well in business. So why business in nursing? Why nurse entrepreneur? Because I believe it's a business.
Yes.
Correct me if I'm wrong.
No, it's a business. It's a business because we are able to earn our living. We have children, we have house rent to be able to pay. So whatever we are able to get as a difference, that's how we support ourselves. So Aeners is a center. As Esther said, it's by nurses. We are nurses, and for nurses. So we intend, or what we have been able to do, is to influence nurses, make a difference in their lives, and be able to show them that there is possibility of being able to grow themselves. Yes. So,
Wow.
Yeah.
So does it mean that if I'm a nurse and I want to join you guys,
Yes.
what will you be doing to me as a nurse who is already practicing in the country? Because you've said you're offering mentorship, right? You as Aeners.
Yes.
So what kind of mentorship are you aiming at? Who is already a nurse?
Our target is actually for the post-college. We find that the working sector is such that they expect you to be 2 years experience.
Yes.
But where do you get these 2 years of experience? And that's where we come in as Aeners. We take you right from school. We teach you the very, very basics, even personal presentation. How do you come in for an interview? How do you now correlate the physical assessment that you've done with the numbers that you're finding? We help you find your way in inpatient practice. So those are really our targets. So that by the time now they leave us and they go for now employment, they are a lot better and they are accepted. And actually, I think you were our own apprentice.
Yes, I am.
Yes.
Sometimes back in 2019, guys, you should know that I was under her care.
Yes.
So now there's this nurse who's out there watching.
Yes.
She's just finished her nursing council examination. Can they reach out to you for the same?
Yes, they can.
Oh wow, that's
we have a
interesting.
program for them. It's called Nurses 101, or if you like to put it, Nurses 1-on-1, where now we take you, we understand where you are in terms of your knowledge, your skills, and then we teach you the practical skills. We take you through the rational thinking, and we just make you a better nurse. So yes, we have that nurse. And then when we do have patients, we are able to work with them, we mentor them through the many things or the many aspects that a nurse needs to be proficient in, whether it is the personal relationship with family, with clients, even with colleagues. And then after that, we also want to take care of your money, teach you how to spend your money, how you should be saving. And then if then after you have worked with us, you need recommendation, we do write your recommendation. And if there are opportunities, we do recommend you to where the employments will be. So we have very many nurses. In fact, maybe we need to go back and check on the numbers, the nurses that have passed through our hands.
I'm sure there's some people who are watching and they're for sure they're saying, yeah, it's true. What they're saying is true.
Yes.
Now let's come back to Esther.
Yes.
Now we've said and we've seen you on so many social medias doing the teaching HCAs. What is this HCA that you're telling us as Aeners you're training?
Okay. A HCA has many names in this country. A HCA actually means healthcare assistant. This is somebody who can work under many healthcare professionals. These are people who can assist doctors in their clinics. These are people who can, even work in a physiotherapy department. Anything to do with healthcare. So that is why they are called healthcare assistants. Commonly known as nurses, some people call them CNA, it depends on
Patient attendant.
Yes,
The same
patient
thing, right?
attendant, yeah. I don't know whether it's how somebody feels I want to call them, However, I think their scope is people who assist patients with activities of daily living.
Sure.
So they come in as complementary staff to the healthcare professionals who are already very short-staffed with a lot of tasks. So let's even take an example of a nurse working in a ward somewhere. There are very many tasks for this nurse to do, from feeding this patient, bathing the patient, making a bed. And truly you don't want to use a nursing resource for that.
Yeah, sure.
You want to leave them to concentrate on the key things. A nurse should be able to assess the patient. The nurse is the one who is supposed to make decisions. The nurse is the one who is supposed to at least make sure if there are any complications somebody asks, but not taking her away to watch a patient for 30 minutes or 15 minutes. That's quality time.
Sure.
So this kind of steps in to complement the nurse by assisting them with jobs that a nurse doesn't have to do.
Yeah, sure.
So that is what a healthcare assistant is, and that's where we would like them to fill in that gap, even to complement the nurses and reduce the burden that the nurses have, so that we can give better care to our patients.
Fantastic. So assuming I have a child who's just finished Form 4, then I bring them to you guys. So what are the requirements? What do I need to bring to you with my child for them to be enrolled to your place?
Oh, good. Being a skills-based course, Form 4 certificate, TVET recommends a D-. So anyone who has a Form 4 certificate can actually do this job. We also hope those people who have great skills, there are people who've been in this job for long, the older generation, never trained, they don't have certificates, that will reach that level of skills recognition and you're certified based on that. But for a Form 4 leaver, a Form 4 certificate, D- and above.
Right.
Yes.
And you've mentioned something about TVET. May I ask what is TVET? For somebody who doesn't know out there.
Okay.
You said TVET has recognized. Me, I'm a nurse, you're a nurse, but somebody out there who is beginning this journey does not know what is TVET. So maybe you would want to mention something small about it.
Okay. TVET is a government body that governs training in Kenya. Anyone training diploma and below. So for the bachelors and above, it's a different board that governs the institutions. So TVET is the body that has been charged by the government to give I think direction, they're the ones who ensure that you meet the requirements. Yes.
So in short, Aeners is accredited.
Okay, we are
But
registered.
You're registered by
Under
TEPRIT.
TEPRIT.
So it's a legit thing, guys. I wanted to make it clear to people because sometimes people end up asking you, you're just telling us things and those people are not recognized. It's better for them to understand that.
Yes.
And that's very good that you've explained and you've elaborated. Now the other question I would want to ask is, I have finished my training. You've told me to come with the certificate, the Form 4 certificate, and maybe, of course, it's not a voluntary thing, like it's not a free thing I have to pay.
No.
Do you guys charge something or something?
Yes, we do. Because it costs to
Yeah,
train
sure.
them, because there are many costs that goes to it, including paying the staff, training, premises and all that.
Yeah.
So it's not expensive. It's only 97,000 Kenya shillings, but that covers many things. It will cover their uniform, the manuals they used to train. It covers for first aid and certification with American Heart Association. It also covers clinical placement, where they go for their attachments, so the money that you pay to the hospitals.
Right.
So it's actually a comprehensive fee for everything, for the entire training. Yes.
So for a nurse, for me to go to school as a nurse, I have to train for 3 years. Right?
Yes.
If I'm doing diploma in nursing.
Yes, yes.
So how about these HCAs? For how long do they train? How is the program?
6 months.
Is 6 months, okay?
So
will you break it down?
Yes, we have programmed or planned it in such a way that we do 2 months of theory, because it's really not much theory, because it's a skill-based competency. So we do theory for 2 months. We also do skills and practicing for another 2 months within the premises. Some will go occasionally to homes where you don't need a lot of skills. Then you have 2 months of attachment.
Wow. So
Yes.
basically that's 6 months, eh?
This 6 months.
All right.
Yes.
Okay. Maybe this one goes to you, Faith. What about the job market? I mean, I've realized you have so many students. Do they all get jobs in the country, or where do they get these jobs from? How do you assist them in acquiring jobs?
For now, I would say about 80 to 85% of our graduates get jobs from the local market. That is from the health institutions or from the homes, or they are taken up by private institutions. So majority of our graduates get jobs. However, there is a small percentage, I would say, mainly the younger ones, that is the 18, 19s, who really have not known that this is the way they want to go. They're having a bit of time to decide whether this is the field that they want to work in. So maybe that comprises about the 15%. However, as you now know, and it is now very rampant, that majority of people are looking for jobs abroad.
Sure.
So yes, that is also one of the targets that we are doing in terms of training this course, so that we can be able to prepare them for the international market.
Wow.
So what that comprises is that we take them through communication skills, we take them through teamwork, we even take them through presentation, how they present themselves, because now they won't have to speak the Swahili or the Sheng language that we are used to. So those are some of the things that we take them through during our training. She maybe did not mention that we also train them in basic life support. So they'll come out from the training, they'll come out with 3 certificates. That's the HCA certificate, they come out with a first aid certificate, and also a basic life support.
That is the BLS, the
Yes,
common
BLS,
one.
yes, the
Oh,
BLS
wow, that's
and the
nice.
American Heart Association. So they are quite well equipped to be almost first on the front line in terms of healthcare. So that's why we are very keen that we train them well.
Wow.
And we are not saying that they are nurses, but we are saying that they are healthcare assistants.
Okay. You mentioned something about jobs overseas.
Yes.
And in the market, like all over social media, you realize that so many nurses are looking for job overseas. And it has come to our attention that even nurses, like those are the patient attendants, also are looking for jobs overseas. Do you maybe like have a program whereby you assist nurse aides who are training with you, get jobs locally and get jobs overseas as well? Or do you have plans underway or something?
Yes, we do have plans, and we have many agents that have approached us from the UAE, from the American market, and even from the Australian.
Wow.
So we're in the process of partnering with a number of them to see how we can get our graduates to be able to go abroad. Yes, so but that is in the pipeline. We're working on that.
Okay.
Yes.
Wow, that
Yes.
is good.
Yes.
Thank you so much for being selfless with your information. And I think so far so good. There's something when I was going around, when you guys were taking me around, I noticed of something you're calling Ava Boys. Maybe briefly you would like to talk about it briefly, maybe in a second.
Yes.
Tell us, who are these Ava Boys?
Our boys are young men, mainly between the ages of 19 and 26, who are out there with their D minors and maybe definitely have not had any training, and we've identified them as wanting to make a difference in the healthcare sector, but they do not have any sponsorship for training. So we've taken them under our arm and our CSR to see how we can train them to be able to provide the services out there. But you're welcome to sponsor one of them or some of them to be able to now do the proper HCA training.
Yeah, you never know who you're talking to.
Yes,
You might get somebody who will support
Yes,
one
yes,
of the boys.
support,
That's
yes.
a good job.
And-
It's a good
and-
initiative because I realized you remembered the boy child.
Yes,
At
yes.
times you find that the community is more concerned about the girl child.
Yes.
The boy's child are kind of sidelined
Yes.
in a way. And it's a good initiative that you've come up with, especially incorporating them in the medical field. You know, in nursing, they normally say, wengini sisters. So you also want to incorporate the boy child and bring them up. That is a good job. Yeah, so keep it up. Keep it up. So now that this is a business, for how long have you been doing it? I'm interested to know because I'm a nurse, and everybody here, my audience know that I'm in the pipeline also of leaving this country, because I feel like Kenya there is no money, you know. But then why should I leave you guys if you guys are doing business in Kenya and you're making it? So we would want to know, for how long have you been in this, and what are the secrets?
Well, I think we've been in it close to 10 years since
Wow.
we left. I left employment close to 10 years ago. Faith left earlier than I did. So what I would say is, for as long as you're consistent in what you do, persistent, and just give good quality, you will make it. I don't know, we look for great money, you know, money depends on what you want.
Yeah.
I think money is the value it brings to your life. For us, the value it's brought to our life is seeing young people transformed. It's not even the amount. I would even say we have a lot of money. So it's the value that it adds to us. Feeling satisfied with seeing the results of the people you've trained, the ones you have mentored, doing well, really makes us feel good, because I think everyone wants to make a difference in somebody's life.
Sure.
And I think that's the essence of doing this. And we are many good nurses in this country. We are able to even change the way we do our nursing here in Kenya. We make it attractable and attractive to the young generation, that from a young age, you ask somebody in school, they will tell you, I want to be a nurse.
Yeah, sure.
Because they've seen nurses doing great job. So I don't know what Faith would say about
yes.
that.
For me, I think nurses are great people, very well trained, and I do encourage many of them to take up positions in even odd environment. For example, imagine if you are in Kenyatta National Hospital, who would make the best HR? It would be a nurse.
Yeah, sure.
So when you've done maybe your first degree, go and do a master's. Go and do a master's in business, and now get the experience in being a HR.
Sure.
So you find yourself as a nurse, but you are a HR. Say if it is even now the photo, the person who is taking the photos in front of us, imagine if they were a nurse, when we are now shooting and seeing those, when I'm actually doing now the catheterization,
Yeah.
they'll be able to focus and focus on the catheterization because they understand the
Yeah,
procedure.
sure.
Let's talk of even maybe
Diversification.
Absolutely. Say whether it is in the IT field, whether it is radiography, anything. So nurses can be what they want to.
Yeah, sure.
But I think many times we confine ourselves to just thinking we must be by the bedside. So there are huge opportunities just have to think of ourselves as being there.
Wow, this is great. It's a great conversation that we're having. I don't know, because in the interest of time, we don't need to take much of your time. I understand you guys are busy. You need to go back to your students and stuff. So maybe what do you tell us? Somebody who is out there and they would want to reach you guys, they would want to come to the institution. How do they get you? Maybe do you have contacts, emails, or maybe directions?
Yes, we are located close to Nairobi Hospital. We are right next to Upper Hill Medical Center, and we are in a location on Raffband Road, Kogeria, Maisonette. We're in house number 14. You'll see our signage, Aeners, at the gate, and the school is called the Leon Training Institute. So you can Google, we have a website, our contact is there, and please come. This is a great place. And we enjoy teaching healthcare assistants. So I don't think you'll be in a better place.
Yeah,
please come here. Yes, come here.
And something that you mentioned, it's important for them to know that Aeners is an associate of
Leon Training Institute.
Yeah, so that in case they get here and then they find a different name, they're wondering where.
Yes, it's actually part of Aeners.
All right. So why two names though?
Well, we want to be recognized as nurses. That's actually why we use the name Aeners.
Okay.
Because if you saw a Leon Training Institute, it could be anybody, it could even be a school, a college. That is why we insist on being called Aeners.
All right.
Yes.
So Aeners and Leon is the same thing. Don't get confused. So parting shot, what do you tell us as we sum up this whole conversation? So what do you tell the viewers?
Just know what you want and follow through, and you get your dreams to come true.
Thank you. You, Esther, you have something to tell the viewers?
Well, I think Faith has said it, and don't be in a hurry to make it, because it's usually a journey. Anything that you do too fast, wanting instant results, it doesn't last.
Sure.
Be consistent.
Sure. Yes. And one thing I've learned from you guys, determination and focus. Determination and focus. You guys have been focused all along the 10 years. Were it not for your focus and determination, maybe you wouldn't be here, right? During our conversation, we've had so many words that, along the journey, somebody approaches you, gives a better offer, but because you're focused and you're determined to do what you're doing, that is why you're here. And of course, you guys are our seniors. You're showing us, you're leading us the way. I think I look up to you. People here know that I'm also trying to, not trying to, but in the journey of what you guys are doing. So I don't know, I'll just try to wrap up from there and say thank you so much for watching. For those who have joined us today, please reach out to their contact, and don't forget also to hit that subscribe button. And what do we tell them? Bye bye.
Thank you.
Yes. You're done.